My name is Kelly Gwathmey, and I am a neuromuscular neurologist at Virginia Commonwealth University in Richmond, Virginia. Welcome to the awareness phase of this independent medical education program and to this Voices of Myasthenia Gravis Enhancing Patient-centric Care activity. This activity is centered on a conversation between myself and Janel, a patient with generalized myasthenia gravis, or gMG, to better understand the lived experiences of patients with gMG, the unmet needs that they face as they navigate their healthcare journey, and how a patient centric approach can help overcome these gaps. This session will prompt you as the learner to respond to initial and follow up questions to encourage you to reflect on and challenge assumptions about how patients experience gMG. Today, I am joined by Janelle. Welcome, Janelle. Would you please tell our audience a little bit about yourself?
Hi, Kelly. Thank you for having me. My name is Janel Worcester-Brown. I live in Maine. I was diagnosed with myasthenia gravis in 2019. And in 2021, I started receiving care for myasthenia gravis.
Excellent. Thank you so much for sharing that. And so, before we jump into our conversation today about the impact of myasthenia gravis on patients with MG, I'd like to provide a brief overview of myasthenia gravis. So, throughout this, we will be referring to myasthenia gravis as MG or generalized myasthenia gravis as gMG. And as you know, it's a rare autoimmune condition that impacts neuromuscular transmission. So, common symptoms include double vision, droopy eyelids, speech and swallow difficulty, arm and leg weakness, fatigue, and even respiratory impairment. So, as you recall, our patients are diagnosed usually with blood testing looking for myasthenia gravis specific autoantibodies, such as antibodies directed to the acetylcholine receptor or the muscle specific tyrosine kinase antibodies or MuSK antibodies. And then remember that those who do not have antibodies on blood testing are diagnosed with electrodiagnostic testing, including repetitive nerve stimulation testing and single fiber EMG. And it's a very exciting time in myasthenia gravis. We have so many new therapeutics available now and then also on the horizon. And so the treatments really range from symptomatic management with acetylcholinesterase inhibitors such as pyridostigmine to traditional immunosuppressant medications and newer therapeutics such as complement inhibitors and neonatal Fc receptor inhibitors. And so, with that, we also have treatments reserved for patients who are having an exacerbation or crisis that are hospitalized, such as IVIG and plasmapheresis. So, as I mentioned, myasthenia gravis can present with many different disabling symptoms. And so, I'd like to now turn to Janelle to understand better the impact of generalized myasthenia gravis and what that has been on your daily living and your quality of life. So, Janelle, how has living with GMG impacted your daily life, including your ability to work, engage in social activities, or perform everyday tasks?
Well, 10 years ago, I was very, very physically active, and we did a lot of outdoors activities, hiking and biking and snowboarding and adventure races. And I was a regular at the gym, and I worked 40 to 60 hours a week, and I was going to school, graduate school full time at the time. So my life was very, very full. I was raising two children as well, and life was really, really good. And then things change very drastically. It's almost like a culture shock for me. I was in my house all the time, not able to leave, very weak. Um, Simple thing. I'm no longer work. I'm not able to work currently. Um, Simple household chores, simple things like showering and hygiene. Those things take uh a little bit less of a priority now than what they used to.
Mhm.
Um, and those lessons aren't all bad. But it is certainly a different way of life, and it was a bit of a culture shock, like I said, and I've had some time to adjust, and look back, which is always helpful.
Well, thank you for sharing that. And I'm sure you and most of our myasthenia patients or myasthenics have significant fluctuation of their symptoms, right? That's the nature of the disease. And so, if you could just let the audience know whether or not you find that the fluctuating symptoms themselves also impact not only your physical function, but your psychological function and social activities.
Not being able to do the things that I used to do, it's not like I can still plan, "Oh, well, I just can't do that." I might not be able to do that today, but tomorrow I may be able to do that. And so I find that whenever I make plans, I try to have a backup plan just in case. And I also have to prioritize what my plans are. And sometimes, even though it's something I want to do, I'll need to say no to because I know whatever I have maybe coming up the following days is really gonna require a lot of energy and effort on my part, so I have to, prioritize, and so the adventure races that I used to participate in, look very different now, the adventure races day to day and reevaluating day to day and throughout the day even, because things may start out strong in the morning and not be by noontime.
Right. I think you made so many great points there, Janelle. And as a provider, every day I see the impact that generalized myasthenia gravis has on patients' activities of daily living and their quality of life. And, I just really see how it impacts their ability to work outside the home, to provide care to their children and their loved ones within the home, to take care of the home and really the psychological burden as well of kind of losing some of that autonomy and flexibility within their schedule. And so I think you really sort of shed light on that for our listeners. Now I wanted to pivot a little bit to discussing unmet needs in generalized myasthenia gravis healthcare. And so there are a number of unmet needs related to GMG care. And to me, again, as the provider, the greatest that I see are barriers to treatment. And so every single day, right, there are patients that I take care of that cannot access certain medications that I'm recommending for financial reasons, or perhaps they live in a remote area. And this is really a concern. I mean, to me, also, other unmet needs include, the fact that the physicians that are assessing some of these patients might not really be understanding the burden of the disease and all of the symptoms and really factoring that in when they're having conversations with their patients about, what the treatment approach should be, right? So, Janelle, from your standpoint, what do you see as the biggest unmet needs in healthcare for patients with GMG?
Well, I think there's a few, like you had mentioned. I live not in a big city, and so the resources are much more limited. I'm fortunate enough that my husband is willing to travel me, all over the state and all over the New England and even to Florida where I've been
Mm.
to get treatment. But I understand not all people are able to do that. And so sometimes they may be told that they um, are at a certain place in their journey, and that's where they feel like they need to stay because they don't have the other options of traveling. Um, Finding doctors who are well versed in myasthenia gravis and realizing that, like myself, I have some other conditions that I feel probably murky the waters a bit when trying to diagnose things, and to be able to look at a person as a whole and look at all of those pieces and how they may interplay with one another. Um, but sometimes I've seen a lot of specialists, and sometimes I think, um, that maybe they're not always right up to date with the most current information on diagnostics and treatment.
Thank you so much for sharing that, Janelle. One way I feel like we as providers can understand the burden of disease that our myasthenia gravis patients go through is through the use of patient reported outcome measures. And these outcome measures measure function, activities of daily living, for example, and quality of life and disability status as well. And, a lot of people think of these as existing primarily in the research realm, but I would like to argue that I think they're extremely important as well in the clinical setting. So, for example, when my patients come into the clinic, the first thing they get is a MG-ADL score and then a scale, and then also the MG quality of life 15 item revised version to complete. And we track these scores over time for all of our patients, and it really provides me the information on how the patient is doing from the patient's perspective. And I can see if we need to adjust treatment and really understand more holistically how the patient's experiencing MG and the impact it's having on their day to day activities. And I'd also like to say I also do include the MG composite, which relies on the exam to score it as well. And so, with that, Chanel, one question might be for you is, why should we even focus on quality of life in myasthenia gravis and other disorders? How do you define quality of life, and why is it important for your providers to know how you're doing from that standpoint?
Well, I think quality of life varies from person to person, and I am the expert on my own. And so I like having the MGADL scoring sheet that I do weekly. Uh, Not only does it help my doctor for insurance purposes when they're trying to get things approved, but it also is somewhat objective. I know, there's probably a little subjectivity in there because of how we interpret the questions, but I interpret those questions the same every time. So that scoring over time should be fairly objective and give a good picture when sometimes I'm not so articulate at being able to describe my quality of life and how I'm doing with MG. After 10 years now of living like this, with ups and downs, of course, a lot of it becomes our norm, and so for me to be able to recall and be able to tell the doctor at my visit, it would be too challenging for me, and a lot of things are just my norm and I would forget. So having the MGADL score um, really is a starting point to be able to talk with the doctor, and over time they see the scores either tracking high or low and being able to, or plateauing, and seeing where I'm at.
Right, that's extremely helpful. And I'm just curious, so what are your criteria for satisfactory symptom control? And what factors do you believe should be prioritized when we're assessing treatment success?
Symptom control, I think if you had asked me even a year ago, it would mean, well, then I was able to get up and shower every day and get out the door and work at a full time job. Sometimes we need to kind of look at ourselves and make peace with some changes that have happened. And I'm fortunate enough that I have been able to do that. I would love to work, but I'm finding ways to feel productive and contribute that works with my MG schedule and the how it varies. My symptoms vary from day to day. Um, and then the second part of your question was what is important?
Right. So, what factors do you think we should be prioritizing when assessing whether or not the treatments we're giving you are successful?
Well, for one, I think listening to how I may be describing my life at the time, it may not be what I used to be doing, but I still can be happy and feel fulfilled doing, uh, living my life with the limitations that I have currently. Um, And so even though it's not what I would have said even, a year or so ago, I feel like, a doctor listening to how I'm describing what's going on in my life, is really important, and it can be positive and can be negative in what they're hearing, but it's giving a more accurate picture, I believe.
Absolutely. I think you're really touching on some important points. I mean, having the information on patients' functional status, their quality of life, be it from outcome measures or just discussion in clinic, is a necessary step, I would argue, toward facilitating shared decision making. And that's really the jumping off point to a productive conversation, as you were saying. So, in your opinion, what are the barriers to effective communication and shared decision making in practice?
Um, I think sometimes it's not enough time. I mean,
Mm,
we our appointment slots are very limited, and so I try to go in and have a list with the priorities that I want to get answered on my end. Um, but to make the most use of the doctor's time because it is so limited and it doesn't give a lot of time for a casual conversation of talking about, so how is life going these days? But so I think that is a bit of a predicament when we have such limited time. Um
So, apart from time, is there anything else that clinicians could do differently to facilitate effective shared decision making?
I think asking questions truly, um and asking the patient what they think. Um, when you have myasthenia gravis, like so many chronic illnesses, a lot is taken away from us in our lives, and a lot of control is taken away from us in our lives. So, taking that back where we can, and having a conversation where we feel heard and listened to, I think is a very powerful tool.
Hmm. Excellent. So, when you're discussing treatment options for your gMG, how could healthcare providers effectively address your concerns about potential side effects, long-term prognosis, necessary lifestyle modifications? How can we do a better job communicating with you about those things?
I've been fortunate. The doctors that I've had have given me pamphlets. They've asked me to do some research and let them know kind of what I was thinking might be best for me. And but I trust my doctors because I don't know enough about the treatment piece of things. I just know my body and what's going on with me. But finding a doctor that I can trust and rely on and I feel is knowledgeable about MG and MG treatments is worth their weight in gold, truly.
Right, and you raise the point of you do your own homework sometimes, and it kind of raises a bigger question of what tools do we have available to us to make this conversation productive? I mean, certainly for me, I rely heavily on educational websites, and I actually develop some of my own education materials that I share with my patients, especially at time of diagnosis and to facilitate some of these treatment discussions and going through the risk and the benefits of different types of treatments. And so, Janelle, what are your preferences regarding tools and resources that might be helpful to facilitate the shared decision making?
Well, I think something like you had just said, where something that you've created yourself is wonderful. Being able to take something in hand and go so that you can peruse it when you are able to focus and not sitting in an appointment. But I also, researching articles and credible sources to find more information. I researched and found very, very helpful information and up to date information on the Myasthenia Gravis Foundation of America's website, and was able to search for doctors on their website as well. There are Facebook groups where you can connect with others and uh, not feel so alone, and that is very helpful. Meeting people in person who also have myasthenia gravis uh, has been a very powerful thing. But I went for so long, even though I had a positive lab result before I was treated, that I didn't feel I felt a bit like an imposter, like I shouldn't sit in on these support groups because I wasn't being treated for it, and so I wanted to be in, but yet I didn't know if I fit in, and it really did make a world of difference for me to be part of that. And you do glean a lot of information with a grain of salt sometimes in Facebook groups, but there is information there, and then you can certainly go look into it further and under reputable sites.
And I can only imagine being a part of a Facebook group or an in person meeting really provides some of that support that's necessary and allows you to learn from other people that are going through what you're going through. And so it's really kind of a built in support system that's so necessary when you have a rare disease, right? Because otherwise, some of my patients feel like they're out there on an island by themselves. And so
Absolutely.
having that community is so important. Um, I think this has been a very robust discussion of the impact of GMG on patients and also strategies that we, the providers, should be using when assessing MG patients. We have focused on the importance of shared decision making and touched on the tools that support this. And, I just really want to thank you for joining this video podcast. I mean, if you have any last minute take home points you'd like to emphasize for our audience, please do so.
Something that I think is important is that learning to advocate for yourself, and part of that is being educated and knowing about myasthenia gravis, paying attention to your symptoms and looking for any potential patterns there may be to see if they're, what's bringing this about. Uh, Maybe possibly flares or what have you. Um, and while I may have advocated for my career for other people, it's very different when you advocate for yourself. And it is doubly difficult when you're not feeling well and feeling like you are lost on an island of your on your own. Um, and I would encourage people to reach out, find your tribe, and learn as much as you can, and know that you're not alone, and and you will get through.
Thank you, Janelle. And I'd also like to thank the audience for listening and encourage you to take part in the reflective follow up questions. So, how have your perceptions changed having listened to this? And listen to the video podcast series and download the clinician and patient resources on the program website. And with that, thank you so much.